So tomorrow, President Cyril Ramaphosa will address the nation about possible tougher lockdown regulations. Joining me now to discuss the factors that could influence his address in light of the second wave is UCT Public Health and Medicine Specialist, Kerrin Begg. Kerrin, thank you so much for joining me this evening. So many factors that could influence, what the President might say to us tomorrow, but what is key for you?
So I think what's key is that the numbers, the rate of increase of both cases, admissions, deaths, as well as oxygen use, which are all our indicators for that we look at in terms of increases. Those are steeper than they were in the first curve, in the first wave, and indeed in the Western Cape we've actually now exceeded our peak of the first wave, and that's been an incredibly rapid increase, far more rapid than we experienced in the first peak. So we really have to intervene. We have to put what we call a circuit breaker in to make sure that we allow the health services to manage, because at the moment the health services are strained. Remember that under our first wave we had a lockdown in place. It wasn't hard lockdown at that point, but at least we had restriction of movement, we had curfews, and we had limits on alcohol, which meant that the health services were able to cope a little better. They're now exhausted. Our healthcare workers are absolutely exhausted, and we're hoping for some reprieve over this festive season, but in fact they're going to be having a tougher time. And so the President has to do something, otherwise we are not going to cope. We certainly know that in Cape Town, and as was the case in the Garden Route last week, that hospitals are full. Emergencies are no longer able to be managed, and hospitals are on divert, even private hospitals. So, we have to do something to be able to have some bed capacity to be able to cope with those who need hospitalization. And
Kerrin, I'm going to assume that this particular time, the festive season, there's a lot of, normally there will be high trauma cases anyway.
Correct. So, that was, and what we saw, so we've always said the Medical Research Council has published the data from the Burden of Disease Unit repeatedly over the years, but we really had a great experiment that we have the evidence for now, that when we had the ban on alcohol, our trauma unit admissions decreased quite substantially, massively. So that is something certainly that I'm sure that the President will be considering in the next address.
When you look at the numbers that are coming out as well, a lot of the age group, the youngsters, the numbers are high within the younger population, and some might look at that and say, but hang on a second, we did say initially, but that this virus does not affect them adversely, but that's not where it ends, is it?
Correct. So remember that cases are a function of who we test. So remember that there are always at least double the number of cases walking around, and that's very conservative because we know that at least 50 to 75% of all cases are asymptomatic, don't show any symptoms. And so first wave, we weren't testing asymptomatic. In fact, our testing capacity was quite strained. So in fact, we were testing probably less. We were only testing severe cases. And so we may not also have seen those 15 to 19-year-olds in the first wave because they were asymptomatic. But now we are seeing those 15 to 19-year-olds in a significant way. And in part due to the fact that we're testing them, in part, and they are in fact becoming symptomatic, but in part also due to the fact that we are seeing those amplifying, or what we call super spreading events, where teenagers are now no longer being restricted by school and examinations, and have been out and about and partying in big crowds. And obviously we're not dealing with the fear factor anymore because people are not so scared of coronavirus because we know a little bit more about it. Of course, the risk of exposure was always there for all children, adolescents, and adults and seniors. But of course, the risk of severe disease was always lower in children and in adolescents, and that remains the case. So even though we are seeing symptomatic adolescents, the challenge is not that they are that they are symptomatic, but that they actually have less severe disease. The challenge is really that they will pass it on to those who are at risk of more severe disease.
So, Kerrin, just a quick one for me. What would you like the President to say tomorrow? What do you want to see?
So I think that all healthcare services would like to see the president implementing some form of restrictions of movement and of mass gatherings, because certainly, the person-to-person spread is going to be there with whatever we do, because people do need to earn a living and need to go and get their groceries done, but they don't need to party. And so I suspect that mass gatherings are going to be significantly constrained, and that's appropriate. I suspect that he may also be putting curfews back in place, and that's linked to evening gatherings and alcohol, because we know that with alcohol, people reduce their inhibitions and start to take risky decisions and make unhealthy choices.
100%.
So I suspect that he will also start putting some alcohol bans back in place again.
All right, Kerrin Begg, thank you so much for speaking with me this evening and giving us your expectations, or at least what you would like to see. Kerrin Begg, UCT Public Health Medicine Specialist.